What's a heart attack? Angina or angina sounds like a heart attack. What's a heart attack?
Yeah, angina is kind of your early warning sign, lets us know that there may be some blocked arteries, but a heart attack is a little different mechanism. Rather than the slow progressive of narrowing of the arteries, you have a cholesterol plaque. And that cholesterol plaque, for whatever reason, and we haven't figured it out yet, decides to rupture. Your body trying to keep blood from spilling out. So if you get an arm, cut on your arm, blood needs to clot to keep it from bleeding out. Problem is when that happens on the inside of the artery at the heart is that it obstructs blood flow. And so then we've got no blood flow to the heart, and then that's where the rest symptoms and the intensity of the symptoms can worsen.
So if somebody's not getting any blood through one of the coronary arteries, the artery that supplies the heart, with symptoms?
Yes, same type symptoms, but much more intense. And again, you're going to get more of a moderate to severe pressure, squeezing, radiation to jaw, neck. But a lot of times we see shortness of breath and nausea, extreme sweating that can occur with these patients. And they're usually not doing anything. They're sitting in a chair when it happens.
So why do we always say things like, that's the time for 911, swallow it? Tell me what you do in that emergency situation.
Yeah, I mean, well, we see a lot of patients come with heart attacks all the time, and I think the worst thing you can do is try to drive yourself or have a loved one drive you, because rhythm disturbances can happen in the middle of a heart attack, and it can happen 2 minutes or 30 minutes into it.
So what does 911 do to prevent that?
Well, 911 doesn't necessarily prevent the rhythm disturbance, but they can save you if you have a rhythm disturbance. Plus, they have people trained in CPR, and they can get your heart rhythm back.
You call the hospital and say, be ready, here, we're coming?
Exactly, and a lot of times all of the trucks now that bring us patients have the ability to do EKGs, which diagnose the heart attack immediately. They send it electronically to us, and we're driving in at the same time the patient is.
So that's pretty crisis management, as I call it.
Mm-hmm.
So when you arrive at the emergency room, do you have to sign in and wait a while?
It kind of depends on the time of night. So middle of the day where everybody's there, you're going to go straight to the cath lab because everybody's there and waiting on you.
So you're going to go straight to the cath lab when 911 has brought you there. Right. Have they started any medicines before you go to the cath lab, or aspirin or anything?
Yeah, aspirin is always given. Sometimes we'll give some nitroglycerin, which can help lower blood pressure, reduce workload of the heart. We're moving a little bit away from morphine now because it can can activate platelets and worsen heart attacks.
We're getting smarter every day, basically.
And oxygen too. So again, ideally the cath lab is the best place. We try not to stop in the emergency department now if we get a heads up that it's a definite heart attack.